Now, young care leavers in England are dying at a far higher rate than other people in their age group due to isolation and a severe drop-off in support from social services once they turn 18. That is the conclusion of a government-commissioned review which called it a national tragedy. 112 care leaver deaths were recorded in the 18 to 24 age group in 2025, which equates to an estimated death rate of around 130 deaths per 100,000 care leavers. That is about 3 to 4 times higher than the death rate in the general population for this age group. Of the 112 deaths, 22 were 18-year-olds, more than any other age in the range, and 40 likely died by taking their own lives, which the review said was potentially 5 times higher than the general population. Well, a little earlier, I spoke to the Children's Minister, Josh McAllister, and he began by telling me why he commissioned the review into the deaths of young people who leave care.
As the Children and Families Minister, every 2 weeks, I get a report that describes for me every young care experienced person who has died. And what I noticed reading that report was both the high number of young people who were losing their lives, but also the patterns and themes in those reports, including that many of these young people are isolated and lonely. And that is such a fundamental part of what has often gone wrong. And it's why, as a country, we all need to wake up to the fact that young care experienced people are dying at 3 to 4 times the rate of their peers of the same age, and that is something that should shock all of us.
I mean, some of the detail in the report is heartbreaking. There was one young man who died last summer from a lack of insulin. His body, it says, wasn't found for 2 weeks.
There's lots of shocking stories in this report, and the fact that that young man didn't have the healthcare that he deserved when he went from being a child to being 18 shows the problems that we have around this thing we call the care cliff. But the bit that's most upsetting about the story is that there was no one in that young person's life who was there to pop round to his house to see how he was, to keep in touch with him. And that is what many of us are lucky enough to have in our lives. And it's the fact that care often leaves young people without that same sense of belonging and identity that is the biggest vulnerability of our care system.
At the same time, though, we are paying, on average, about £320,000 per year to private providers for private children's care. Some people might say that's an absolute scandal.
It's shocking, isn't it? The fact that there are really vulnerable young people who are being placed in homes where there is flagrant profiteering taking place. There are a subset of young people who are even more vulnerable, who are on a deprivation of liberty order. Average cost of a home for children in that situation is £700,000 a year.
Wow.
And this speaks to the fact that, you know, when children reach this point, we end up placing them hundreds of miles away from their school, from their friends, from their community, at huge cost to the state financially. And the outcome from all of that is frayed, weakened relationships that leave young people at the age of 18 without that tribe, without that network of connections.
You've called this one of the biggest inequality of our generation, like a civil rights issue. Are you actually going to be able to fix it?
Over the next 3 years, we're resetting the children's social care system in line with the review that I published for the previous government. That's coming with £2.4 billion. Most of that is going into providing much more intensive support for families in the first place so that we can avoid having children enter care to start with. And with the care system itself, we are both doing more to support kinship family networks where an aunt or an uncle or a grandparent might actually be able to step forward if we support them enough. And secondly, and this is a really crucial point, we are taking steps now to dramatically expand the number of foster homes in England.
Roughly 1 in 3 care leavers are NEET, New Labour, and before that has this huge problem with the number of young people who are basically long-term out of work. And there are calls to sort of reform benefits so that they can't have them at that age. I mean, do you support that?
There are lots of young people out there who do want to be in work. They do want the support that gets them into a permanent job where they can contribute, pay taxes, stand on their own 2 feet. And there are a subset of young people who are care experienced where the proportion not in education, employment or training is actually higher than a third. It's nearly 40%. Now, for those young people, making sure their housing is in a good place, making sure they've got good, positive relationships with friends and a sort of family network, those are foundational for them being able to get into work and education. And we're taking lots of steps to improve that. There is a responsibility on councils to make sure that they are providing the support for young care experienced people to get into jobs as well. You know, councils are quite big employers. They could offer quite practical job opportunities, apprenticeships to their own care experienced young people.
Josh McAllister, thanks for your time.
Thanks.
Well, I'm joined now by two people who have experienced the care system and are now campaigning for changes to it. Chris Wilde is the author of the books Damage and the State of It, and Louisa Foyle, who now works as a development officer supporting those who leave care in London. Welcome to both of you.
Thank you. Thank you.
Louisa, you listened to the minister there.
Yes, I did.
I mean, he clearly, feels the pain of the situation. Were you convinced by his answers and solutions?
I will be convinced when there's actions that have been taken. Talk is free, it's not cheap. And we're talking about people's lives, and we're talking about people's children's, and we're talking about future prime ministers, future doctors, future architects. These are young people that need a voice, that need care, and that need a humane approach.
And what is the systemic problem in the care sector for children that produces these horrendous results?
I think it's catastrophic first and foremost, and I think it's because it's been privatised and it's become a money-making mechanism. So it's kind of money before care, and that's how the system's become. And I think we've just allowed it to spiral out of control. We've got young people who are just living in unregulated houses where private equity is just taken over, and they're not safe. It's all about profit first, and that's where there is a danger.
So what is the most important thing, Louisa, that needs to be fixed, do you think?
The thing that, for me, is fundamentally free, it's for us to be humane, to treat these young people as we would treat our children, to not just, stop resources and services at 18, to actually deal with these young people adequately and give them suitable and affordable accommodation. Look at the Pan-London offer that I work on, making sure offers are consistent and persistent no matter where these young people go. Also looking at the criminal justice system and the decriminalisation of care leavers. Care leavers are 4 times more likely to be arrested than their peers. We're talking about mental health. We're talking about psychological issues. We're talking about subconscious issues. We're talking about trauma. These are serious things.
And when you're in the care system, as a child, do you feel as if you've literally been discarded by society?
Absolutely. When you're put into a system that is built to benefit other people and not necessarily you, and you're stripped of resources and services, and you're left inadequately without any help, where do you expect that person to go as a human?
Doesn't this require not just more money and resources, but a societal rethinking of what it means to look after young people?
Absolutely, absolutely. And in 2022, we published the Independent Care Review with Josh McAllister, and within that, one of the main recommendations was to make care experience a protected characteristic, where it would be illegal to place under the Equalities Act young people in these situations where they become unwell, where they're getting groomed by criminal gangs. It needs an overhaul. It needs an overhaul. And I think what we've seen today in the report being published is just the tip of the iceberg. The system, there's so many problems, and it doesn't start with housing, it starts with education, opportunity, but also community support as well.
Because we've really heard very little about it, haven't we?
No,
It starts with, for me, it starts with education first. I think everyone has been misinformed as much as everyone else. I think it's about terminology. It's not what you say, it's how you say it. And I think it's also about us, moving humane, moving with hearts as humans,
And treating children in care as children. They're human beings, not second-class citizens.
Or delinquents.
Or delinquents, exactly. And it's changing that narrative and that education around it. And I think it's not just social care, it's every sector has to have some form of education around the care system and what that is and who these young people are.
And what do you say to kids in care? I mean, what language do you use to them to make them feel that there's light at the end of the tunnel?
I have the privilege of running the Children in Care Council Youth Board, and I use words such as overstanding. I don't want to understand my young people. I want to overstand them. I pour affirmations into them. I treat them as a mother would nurture their child, and quite frankly, those things they're detrimental, and the things that we ask for as humans and as a professional, that is care experience, is fundamentally free. If your morals were in place, then your budget will align with your morals.
Absolutely.
The funding is irrelevant because your heart needs to be in it.
I hear what you're saying. It's a terrible phrase, but I do hear it. I understand the pain, I think, and thank you very much indeed for your time. Louisa Foyle and Chris Wild, thank you very much to both of you.
Thank you.
Sorry, we've slightly run out of time.
That's right.
Thank you very much. And again, if you've been affected by any of the issues in this story, you can certainly seek help at channel4.com/support.